those are the titles of the grant and the numbers of the grant. And so I'll begin by telling you, and since they won't let me control it, I'll have to use my eyebrows.
Okay.
See, such power. Thank you. Why are we doing cancer research? The components of the grant, how you can participate, and a little bit more information. And I've tried to tell everyone to keep it to 10 minutes, so I'm the PI, I can do what I want. There's the context. The context is cancer is a killer. The males have a 1 in 2 chance of developing cancer over your lifetime, females a 1 in 3. And that's across the US, not just in Guam. So what makes Guam different? Well, the numbers. I only chose one, the males. The incidence of cancer in males from the time 2002 to 2007 increased by 22% on this island. In the US, cancer in males incidence dropped by 2%. In Guam, the mortality rate of Guam males increased by 100%. It doubled. In the US, the mortality rate decreased by 22%, or 2%, sorry, only 2%. Even so, the trend is downward in the States and upward here. That's a clear disparity. The same sort of disparity exists by ethnicity, for females in certain cancers and various other things, which you will hear from later. The highest mortality rate, of course, everywhere, for both sexes is lung cancer, and we know the main cause of that. But women on Guam die from breast cancer at 1.5 times the rate in the US. And cancers in the Pacific Island populations are often related to lifestyle. Smoking, obesity, physical activity, poor nutrition, betel nut, which we are studying and you will hear about, socioeconomic status, or infections, and all of those are candidates for interventions, which is why research is really useful in this case. Pacific Islander populations, that is, especially in Guam and Micronesia, are disproportionately affected by cancer. And every one of you knows someone who's affected by cancer. The island populations are unique. We're very different from the US population. It's underserved. You know, access to treatment for cancer until recently, radiation therapy, it was just not available. And it's unnecessary. It doesn't have to be that way. The issue of health disparities is a social and economic issue as well as biomedical. And that's why it fits very well into what the university does, which is bring together all sorts of different disciplines to focus on a problem. Now, the partnership grant is the University of Hawaii Cancer Research Center, which is one of their premier research institutes at the University of Hawaii and the University of Guam. So it's an MICCP, Minority Institution Cancer Center Partnership. We're the minority institution, and they're the cancer center that we partner with. We had a 5-year planning grant, which was extended in a year and then another year, of $3.5 million. And that was awarded in 2003. And we planned and we put together the infrastructure and we made sure that we had some faculty that could do the work. And then we wrote our big grant, the U-54. There are only 8 of these in the United States, and Guam and Hawaii have one of them. It is a very prestigious and large grant, $12.5 million over 5 years. And we did it because we showed we're making a difference on this island. The overall goals of the grant: to increase cancer research activities, and I will tell you how we've done that, to increase the number of minority scientists, particularly of Pacific Island ancestry. NIH doesn't care whether they live on Guam or in the States, they just want more Pacific Islander ancestry scientists. To strengthen the research focus of the Cancer Center of Hawaii on cancer health disparities. They do a wide range of things in Hawaii, but this will sharpen their focus on health disparities among Pacific Islander population, and to enhance the awareness of cancer and cancer prevention. Ultimately, the goal across the board is to reduce the impact of cancer on the territory of Guam and the region, and Hawaii. So how are we doing? Increasing cancer research and researchers? Well, we had no cancer research in 2002 and 2003. Nearly 10% of our faculty have now been involved in some type of cancer research. We have 5 research fellows that have been funded. We have 6 projects that have been completed, over 15 peer-reviewed publications. This is how you measure things in academia. From no education in cancer health disparities to 1 PhD student, who you will hear from, who has gone through the program, been supported by the grant, and graduated with a PhD in epidemiology from the University of Hawaii, our very own faculty member. 6 master's students, 22 students have been trained in this area. We have a Guam Cancer Registry that was pretty lame in 2003. Yes, it was on the books, but it wasn't funded. It didn't have procedures in place. It had one very hard-working epidemiologist who was trying really hard to keep it going. And now I'm able to give you statistics about mortality for males. Not available before. We were not able to tell you. In fact, even now, before 1999, those data are just not available. And he will talk to you about that. And we have many, many partners. And they're all sitting around. They're all our partners. And we're doing outreach such as this. Academically, we're having a new specialization in cancer health disparities in our Micronesian Studies Master's program. That's under review right now. We have under construction a public health track in our health sciences program, which should be available next year. And the efforts of the university have been focused on cancer health disparities, the social, economic, public policy, the scientific part, the entire wraparound piece of how cancer affects our island. Collectively, you, our partners, and us, we now have a physical center for the Cancer Research Center. Little tiny house down on Dean Circle, house number 7, stop in if you're there. There's no smoking in restaurants. There's the Natasha Perez Protection Act, Public Law 2880, which is in June 2006. We have a tobacco-free University of Guam, not a betel nut-free yet, Guam Community College, Governor's Complex, public buildings. You can't smoke within 20 feet of an entrance. There's a tobacco tax increase, probably the biggest and most important piece of legislation that will help the future of the Cancer Registry, because it supports the Cancer Registry with a percentage of the tobacco tax. Thank you. There's only one senator here, but I will thank him. Thank you, Senator. Good job, senators. And good job, Governor, for signing that. The Guam Cancer Registry is the hub for a Pacific regional registry. In the region, the registries were even at a more beginning stage than ours were, and they're being upgraded as we speak with different grants. The U-54 itself is a very large and comprehensive grant. It's meant to build the infrastructure at the university so that even if this funding were not available, we could get independent funding for the type of research we do. It supports the registry, biostatistics, which support all of our grants, communications. We have to speak to Hawaii and they're 4,000 miles away. We use video conferencing using a satellite. No, we use the internet now, sorry, 21st century. And we do that once a month. We see them in person using a video conferencing facility. We have a website that you should check out too. And then the developmental cores where the real research takes place, which you'll hear about today. Basic research, outreach, student scholarships, faculty training. And this is what our team looked like. See the president there in the middle? This is when the grant was awarded. All those people are doing research, outreach, and training in cancer. Now, how can you participate if you're not in that picture? Join the picture. Join a team that's working on a project. We would be happy to have you. Become a mentor for a student. Contribute to the American Cancer Society Relay for Life. Every little bit for cancer research helps the university. Participate in one of the studies. We need betel nut chewers, so we know one famous one here that will help. Breast cancer survivors. Participate in a focus group. Join the outreach. Youth Tobacco Cessation, which you'll hear from today, and check out our website. We'd be happy to have you. Now, I always like to end with some behavioral modification requirements. What can you do to reduce your cancer risk? They're all behaviors that are very different.